see, I think we can proceed from here. So welcome all of us. Thank you.
Tumpigie makofi tena daktari. Thank you very much, Dr. Lenai, for letting us know we have the blessings of peers. We don't need to proceed with the event. So I'll breach protocol once again and show you the excerpt that I had. And now, ladies and gentlemen, help me appreciate the good writing of the health journalists in the room, including the author of this piece that I'd like each and every one of us to grab after this. You may just be starting from where you are. Yes, thank you very much. That is Leon Lidigu with the Nation Media Group, and we acknowledge other colleagues from the media, of course, distributed within the different tables, and we look forward to engaging you for more reporting and amplifying the conversations in the fight to bring malaria to an end. Dr. Lenai has just mentioned a bit of the guests we have in this room, and probably to give us a more in-depth also welcome and to acknowledge the rest of the other guests. We are Africans and definitely would like always to be recognized. I'm also in the room. So, ladies and gentlemen, his name is Dr. KKK Kibor Keitan, the head of the Malaria Control Program. I'd like to invite Dr. Kibor to the stage and to welcome us once again from a program perspective and to acknowledge the partners in the room. To begin makofi tena. Asanteni.
Well, the chair of Parliamentary Health Committee, Dr. Bukose, Member of Parliament for Nyakach, Aduma War. I want to, and all protocol observed, as I mentioned the names of others, I will surely do that. I just want to take this opportunity to welcome every one of us and share the reason why we're here is because we still have people suffering in the communities, among ourselves, among our relatives, and even as individuals when we travel to the regions where there is malaria. So the reason why we are here is to look into ways of eliminating suffering from caused by malaria. So just to mention the one who has just spoken is the director for primary and primary health care. That is also the director of preventive and promotive health care. And we have in the room also a representative from WHO, Dr. Dan Otieno. We have members from USAID PMI, that is President's Malaria Initiative, who are supporting us massively in the fight against malaria. And I will mention quite a number of activities that they do in the fight against malaria. We have my co-chair in the Zero Malaria Campaign Coalition, Liz Ndonjira, who is here with us. We have the country director for AMREF, Dr. Ndirangu. Thank you so much for the support, especially in the community fight against malaria. As some of us remain at the national level, we have communities, and that is where most of the economic challenges when it comes to malaria are, and AMREF has been a very key partner in that. Just also to recognize the chair of End Malaria Council, Mr. Grace Kitonga, and thank you so much for the great support that you accord us in this fight against malaria. We know we still have resource gaps, and resources are key in this fight against malaria. I will not be able to mention all of us. Ladies and gentlemen, allow me to recognize everybody, the youth corps, and each individual, including James Wamaneti, who is here with us. We are very grateful for the great work. We have our SDS here, Mawira. We have CMCC from Kisumu, Liliana Dayo. So just to go straight into the reason why we're here. Today, this is a build-up to the World Malaria Day, which is on 25th. And I want to take this opportunity to invite all of us to Kisumu. It will be in Poteng Primary School. As our hosts are already here, the CMCC and the Member of Parliament. So you are all invited to that place. So the theme for this year's World Malaria Day is health, equity, gender, and human rights. And I will go through this presentation to give us an outlook of what we are dealing with as a country. So the theme here is gender, health, equity, and human rights in approach to provision of health care and health services, and specifically for us in the malaria space. And our slogan is accelerating the fight against malaria for more equitable world. And sisi hapa Kenya tunasema haki na usawa wa afya kwa wote. So we understand that when we talk about gender, we know women, especially the expectant mothers, are still at higher risk to the consequences of malaria, but also accessing healthcare services. And that is why we are bringing this gender, health equity, and human rights approach to this. And in human rights, we know everyone has a right to timely and quality, affordable care, and especially for accessing malaria services. And we want to implement an equity-oriented, gender-responsive, and human rights-based approaches in management. So in the National Malaria Program, which is under the Ministry of Health, under the Directorate of Primary Health Care, we have malaria program. Our vision is to have a country free from malaria, and this is the objective of the region and the globe at large, to eliminate suffering from malaria. And what our mandate is to coordinate all us partners who are in this room and others who may not be in this room towards a malaria-free Kenya. And we just came to an end of our strategy, and we did a malaria programs review to see what we've done, what we've achieved, and areas that we need to enhance our performance. This is just to give us a picture of how it was in 2019 and what we are in 2023. Someone mentioned a while in some other meeting that we're just playing with colors. We are really, you try and improve in one area, you see another area which is increasing. So the area which is in red, we still have high prevalence of malaria. We can see in 2019, Turkana region was a bit light, but now it's going darker. We still have the Lake region counties. We have Busia, Migori as areas that still has high prevalence. We have Kisumu, Siaya, and other counties along the Lake region, and also the coastal region. Let's proceed to the next one. So the objective of our fight against malaria as a country is in these 6 areas. The first one is what we call the malaria prevention, and to ensure that there is universal coverage of preventive measures. And when we talk about malaria prevention, that is our main target. When we miss that is when we can bring these other areas. In malaria prevention, I want to inform you that we have issues like use of the long-lasting insecticidal nets. Those are the LLINs, which we are in the process of distributing 15.3 million nets across the country to protect about 27 million people. We have what we call the larval source management. We have IRS that we've done in 3 counties, Migori, Homa Bay, and Busia, to bring down the cases of malaria. And Homa Bay County is one of the areas that some of these interventions have worked quite well, where we moved from a prevalence of 38% to a prevalence of around 3%. And this is a great, and we want to replicate that in other areas as well. Busia is one of the counties which has very significant prevalence at the moment, and we have all these interventions from IRS, MassNet, and other interventions as well. We also have in that prevention, we have what we call MIP, malaria in pregnancy, where we give intermittent preventive therapy, and we encourage all our mothers to get this, who are expectant, to get this treatment. In case management, we also have, ensure timely diagnosis of those that we didn't manage to prevent, and ensure that there's timely treatment in facilities and in the communities. And this one we are liaising with the primary care networks and community health services to ensure that we do this at the community, at the grassroots level. So we also have the social behavior and communication change, And this is where my co-chair at SMCC's our core mandate is to ensure that we get the information, not just the information, but the right information, and we correct the misinformations that have been spread before, so that we understand the scope of the problem, and we communicate the appropriate measures so that all of us know what is our responsibility in this fight against malaria. That is our SBCC, and Sang is here, who is leading that area, and is responsible for quite a number of this communication, including what we are doing here. This is about the trends that we've noted over time. The incidents for the strategy, we managed to move from, to drop it from in 2019 to the moment. We drop, there's a significant decrease by 7%. 7% is actually a good decrease, considering globally the curve is the trend is going upwards. So there are challenges that are coming up: climate change, unpredictability of the weather. You know, we need to be alive to those. We have new vectors that include Anopheles stephensi, and we are in constant surveillance. And one of other strengths is surveillance, monitoring, evaluation, and operational research, that we want to be in tandem with the researchers that are coming up, new information, so that we ensure our people receive the best quality of care, the best medicines that are available, the best interventions that are available as research progresses. As you are aware, the malaria vaccine research was done here in Kenya, and we have now rolled out into the Kenya Expanded Program on Immunization. And that is one of the greatest achievements over the last period in research. And we are going on with quite a number of other interventions. We have research in seasonal chemopreventions in malaria. There are still quite a number of gaps, despite the achievements that I've just mentioned. The strategy for 2019-2023 was funded to a tune of around 57%. So there's still a huge gap of about 40% that we still need resources. And if you are asked why the colors are still like that, it's because of resources. You know, there are other things apart from malaria that require these resources, and there's competition for resources, but we need resources to be able to enhance our interventions and increase the uptake of treatment, ensure that the timely commodities, ensure that the interventions we use are monitored, and that where they are not being used, for example, the use of nets. Right now we know quite a number, over 90%, of those people who have nets use it appropriately. So these are some of the emerging issues, and we have also cross-border management of malaria that we are making in the next strategy. We are looking into such issues so that when we are addressing malaria in Busia, we ensure that we work collaboratively with our neighbors so that we address on that region, similar to Migori, where we have Tanzania having similar issue with malaria. Having said that, I still want to say that is the scope of the problem we are dealing with, and we have made great steps in elimination of malaria, control of malaria. So in the country now, we have a dual approach. We are looking at control as well as working on elimination. So in areas where the prevalence is still high, we want to bring it down to at least 1%. When we get to 1%, where counties like Kirinyaga, Nyeri, Laikipia, and Nyandarua have achieved, we want to go to elimination because we want to get rid of it completely, and we've put on strategies to ensure that we achieve that. What we need is just support, because what you know is that diagnosing one case of malaria in Nyeri is not equivalent to getting one case in Busia. In Busia, you test 100 people, you get 40 might have malaria. But in Kirinyaga, you need more test kits. You will test 100, you will probably get one or none. So it requires a lot of resources, investment in the counties, because you know, when you have less than 1%, it's easy to ignore it as not a problem, but it is still a problem. And all of us travel around, and mosquitoes don't acknowledge boundaries, and we need to put all these interventions all across. Having said all this, we've done our review of the strategy, and we've noted quite a number of challenges that were there, which we will work together as partners and all people who are affected, and some of us have suffered economic losses because of malaria, ensuring that treatment is available at the lowest level of the community, and utilizing the big agenda of the country, primary care networks, to ensure that we achieve UHC. We want to ensure that malaria interventions are put across all these stages and all these levels of care. So with all those many remarks, thank you. I want to officially now invite my director to take over the rest of the program.
Thank you so much, Dr. Kibor. Again, a round of applause to our head of program. Thank you for that great presentation and also giving us a snippet of where we are and where we have come from in terms of control and also towards elimination of this great disease of public health concern. Allow me at this juncture to invite our speakers, and at this juncture I would like to invite Rosalyn Omolo, CEC Health Homa Bay, and the Secretary General for the CEC Caucus to give us a highlight of the management of malaria in the counties. Rosalyn? Is Rosalyn around? Now, listening to Dr. Kibor, from 38% to 3%, I think I want to call it the Homa Bay magic, isn't it? For us epidemiologists who are in the room, 38% to 3%, and it's still the lake is still there with all the challenges. I think Homa Bay needs a round of applause, isn't it? Yeah. I was just talking to the ambassador from ALMA, and I was telling him that 3 countries have managed to eliminate malaria in Africa: Algeria, Mauritius, and the 10 islands in the west of Senegal, the archipelago of the Cape Verde. Now I was telling him, I think we need to go and see what Cape Verde has done. And also we need to see what Mauritius has done. And also Algeria. I think we need to start with Homa Bay first. See what Homa Bay has done, reducing from 38% to 3%. I think that is a great achievement in terms of locally. So I think Homa Bay, I think all eyes on Homa Bay so that we see the Homa Bay magic. I think, Joy, you are in charge of elimination. We need to know what was done and which are these magic steps or initiatives that they put in place. Congratulations again to Homa Bay, the team and the partners who are working there. I know PMI, you are doing a great job. Since we don't have the CEC for health from Homa Bay, allow me to invite Dr. David Kahoya, PhD, who is the project country director at Palladium, to give us investment case for malaria control in Kenya. David, a round of applause as David comes.
Yeah, thank you very much. All protocol observed. I'm here not to make a speech, but to present the investment case. If you want to make money, this is where you can make money. You can actually make a lot of money in malaria. So I want to show you how to do it. So I'm actually here to present one of the support areas that we did from our project to the National Malaria Control Program. But before I do that, let me introduce myself. My name is Dr. David Haoya. As you've been told, I lead the Propel project, which is a USAID-funded project implemented by Palladium. We focus on healthcare financing. And so I'm not very technical about malaria control initiatives that you've been shown here, but I know how to finance them. I know where to get money to finance them. And so that's why I'm here. So if I misspell or I misrepresent some terminologies in malaria, please forgive me. But I'll not misrepresent you on where to get funds. We know where to get funds to manage malaria. So for me to actually take you through, I'll first take you through a background. Malaria is still a huge public health threat in Kenya. As you've been told, although we are celebrating the reductions in prevalence and incidence in different parts of this country, we know that it's still a huge public health threat. And you saw the map that was here. We actually can nail down where the problems are. We know the problems are in the Lake region and some parts or other parts of this country. But progress has been made in the fight against malaria, which has resulted in reduced malaria mortality and morbidity, as you've been told, 32 to 3%. And to me, that is quite magical. But despite the progress, 3/4 of the population is still at risk of the disease. And not just, and when we talk about 3/4, we are basically talking about very many people, including yourselves. And so that's why it's important to know how this disease can be controlled so that we are not at risk of contracting this disease. Next slide, please. So just to give you a snippet of the funding for malaria services in Kenya. Kenya has inadequate funding for malaria, that's a fact, and the program, the National Malaria Control Program head has just mentioned that had they got more funds, they would actually have eliminated malaria. And so the resource inadequacy is a problem. And it's not a problem in malaria alone. It's a problem in many other diseases, and not just in health. We know that there is a lot of competition for resources, competition for other services, including infrastructure development, education, and so on. So each sector is crying for more. So it means that we need to start looking at what is the best way of harnessing the little that we have, improving efficiencies for the money that we already have. But then more importantly, what is it we need to do to actually harvest more benefits out of the investments that we have? So malaria is heavily funded by government and household. I think this is important to note because I know that the donors have also contributed quite a lot, but when you look at the national health accounts, when you look at the total health expenditure, meaning when you look at all the expenditure of to malaria interventions, and then you try to track it by the source of the funds, you realize that government is contributing a lot. And sometimes the reason why we don't acknowledge government is because when you go to a public facility, you already find a building already there, built by government. But then we are now looking at where are these funds now to make us get services from those buildings built by government. And that's why when you look at it overall, you see heavy investment by government, but then we need now to see the funds that will make us now provide services. The second group that contributes a lot are the households. They contribute to the tune of about 35% of total health expenditure for malaria. Now, what that means is that if you do not have money and you are one of those households, you just suffer for malaria without treatment. And that is quite a big problem. Then that's why you find some people end up either dying, or if they do spend any money, then they have no other money to spend on anything else, what we call catastrophic health expenditure. You have school fees to pay, but because you've spent all the money to pay school fees, you have no other money to spend on education, catastrophic. But even after spending on catastrophic expenditure, you end up being impoverished. You can't recover. There are some people after they spend money, they can never recover. You find them quoting 3 years ago, they say, you see, we are in this state because 3 years ago we spent money to cure one of us. So it impoverishes them. But of course, like I said, the donors come in handy to also provide the support that we require, as well as the corporations, the private sector. And that's why we are looking at potential areas where we can make money. One of them now we see is private sector. We can make more investments by harnessing the resources that come from private sector. This is, if I may say, is untapped. Because if we can harness the potential of the private sector, then we are likely to increase the funding. But another thing which I must mention is that government, there is also opportunity for us to increase funding for malaria through government sources. And those, of course, for those who participate in the medium-term expenditure framework, you know that government do not just dig in the pocket and give you money. You must be able to put a case on the table because it's a resource-sharing table. So you can't go there and say, you see, I'm from a region which has a lot of malaria. A lot of malaria to an economist is nothing. You need to convert it to something that is understood by an economist or somebody at Treasury. And that's why we did this investment case, so that we can now quantify, so that when we are seated on that table, as education are making their case, health is also making their case, including malaria. Next slide, please. So the objective of this investment case, which we did, was basically to determine what is the cost of providing malaria. And cost of providing malaria, as you will see, there are those what we call direct costs, but there are also opportunity costs. So we tried to bring all of them together so that we identify what is the actual cost of providing malaria services. Now, the second objective was to estimate the benefits. What are the benefits? If we asked you what are the benefits of treating malaria, of course, we know very well that health and education are the only services that have two benefits in one. You actually, when you are treated of a disease like malaria, you feel better. That's one benefit. The second benefit is that after you have felt better, you are now able to make economic contribution and make money. And so using those two, costs and benefits, we are able to now compute what we call a return on investment. We take the benefits, divide by the costs, and then we see if the ratio is greater than 1, we see there is value to invest here. So you already know where you can start investing. You can now start investing in malaria once we see what is it that you get when you divide the benefits and the cost. Because there are many investments out here. When you do that division, you find the ratio is just barely above 1. But for malaria, you will see the figure shortly. But before we do that, we estimated 4 interventions. As Dr. Kibor mentioned, we have various areas that malaria interventions are happening. We have malaria prevention, case management, and social and behavior change. So those are the ones we considered because we realized that there is more impact when you invest in those areas. And we looked at 3 scenarios. We looked at the business as usual, meaning that we do things the way they are now, without any additional interventions. We call it business as usual. So tomorrow, things just happen the way they are. Then we also looked at what we call a modest scale-up, trying to say, what if we did just 15% of what we have today? What will be the impact? Then we looked at a rapid scale-up, where we say, okay, we go full-blown and cover 90%, because at the moment, we may not be covering 100%, but what if we just decided, let's go full-blown and cover 90%? So let's go to the next slide to see what framework we used. Like I've mentioned, we looked at the costs, and then we looked at the benefits. And when you look at the benefits, it's not like a profit where you go into a business and you compute profit. For a disease like malaria, you need to look at all the benefits, including what I had today in the breakfast meeting. One of the speakers has given me some idea, because you know ideas sometimes you learn from colleagues, that there are certain things we may not even have considered as benefits, that when there is no malaria completely, when you eliminate malaria, do you know what will happen besides what we listed? You will end up with more tourists. There are more tourists which will come. That's a benefit I didn't put. So what I will be showing today will be actually an understatement, because if I put the benefit that will come from more tourists, you will see that the figure will even go up. So we did look at those two, and for health impact, we looked at malaria deaths averted. So there are many of you who will have died because of malaria, but because of the treatments you got, your death was averted. Now, because your death was averted, you are here working and earning money. So that aversion of your death has actually made the country get some money from you. So had the country not invested then to control malaria, it will have killed you and will not have benefited from your income. We will not have taxed it because you will not be there. But now, because you are here, we can tax you because the malaria was averted. That's one area that we looked at. But the other area we looked at is, now that you are here, what is your productivity? Are you productive, or you are just here and not productive? Now, because we don't know the productivity of each one of you individually, we have the Kenya National Bureau of Statistics, which has computed the GDP per capita from where you come from. If you come from one county, we can look at that county and say, what is the average productivity of somebody living in that county? And put the mean on your head. So your productivity is the mean of your county. So it means that if we averted 10,000 people from your county, we multiply by the mean of that county. We get the value of the benefit from that county. Now, that plus the aversion of your death, we can now put together and divide by the cost of investing in malaria and be able to see what is the ratio. Is it greater than 1 or less than 1? Now, to do that, now when we put them together, we get what we call return on investment. When you invest in malaria prevention, we are likely to see a return on investment, which is what I'm going to show. And we did that and then followed up with the gap, a funding gap. So the data sources we used were basically the census data, the Department of National Malaria Program data, and some costing that has been done all over. Next slide, please. So when we did all that, what we found is that we need 15 billion in 2030 if we do business as usual. Because at the moment we are spending about, in 2021, we were spending about 13 billion Kenya shillings. But so business as usual means that we only factor in population growth. We don't do any scale up of any intervention. But when we do modest intervention, we will require about 58 billion Kenya shillings to be able to just increase the scale of what we are doing in those three interventions by about 15%. But if we did about scaling up of about 90%, we will need 64 billion Kenya shillings in 2030. These are not cumulative figures. These are the money you will need then. We have data in the report which shows on a year-by-year basis how much money you require. And as I mentioned, the baseline was 2021, which we were spending 13 billion. So increase in costs is basically due to expected increase in the population covered. Because as the population increases, of course, you need to cover more people. Next slide. So what we saw when we did that analysis is that the business as usual will actually occasion a marginal increase in the, over time, of course, in the cases of malaria. Meaning we are making some steps, but the malaria cases will still increase marginally. But when we increase investment, but modestly, we see a decline in malaria cases, that red line in between. When we scale it up even more, what we call rapid scale up, we see even a higher decline. And remember, I've said, the moment you are not suffering from malaria, we are able to have benefits from you. Next slide, please. So this is a case of rapid scale up, the same picture, that with the business as usual, you will continue seeing cases increasing slightly, but with the modest and rapid scale up, you will see a decline in cases of malaria. Next slide. So we decided that because the country is divided in different endemic regions, we don't want to generalize, because there are some benefits in investing where malaria is, as opposed to investing where there is no malaria. As we were told, you can only get 1 or 2 cases in Kirinyaga, but if you go to Busia, you'll get more cases for every 100 that you test. Then we saw the Lake region, just as an example. Modest scale up, there are more deaths will be averted, 21,000 in the Lake region when you do modest. meaning 21,000 people will be available for us to tax. You can start seeing the benefit. Then if you do rapid scale up, you get 30,000 people. So next slide. Of course, the data is there. We will be able to share the report so that you see. So the issue is about how then can we convert those people who have been treated to some economic benefit. So we see that the Lake region, if we convert those people who survived plus the benefits that accrue from such, they will be able to get 134 billion when we do modest scale up. 134 billion Kenya shillings. Remember, we are just spending 13 billion in 2021. But now, if we just increase investment a bit, we are able to get 134 billion in just about 9 years. Look at the rapid scale up, 198 billion. So if you are looking at about 5 or 8 counties in the region, divide that, you find that each county is harnessing several billions of shillings. So if we are looking for investment, Malaria is the place to go. Next slide. So there's a high return on investment over the longer term, between 2021 and 2030, about 9 years, with about 4.4% shillings per every shilling invested. Remember I said if that number is more than 1, it's a good place to invest. But now it's 4.4. Many businesses don't give you more than 1.4. They'll give you about 1.3, 1.6. Malaria gives you 4.4, meaning for every shilling you invest, you get 4 shillings, just in 9 years. If you do rapid scale up, you get 5 shillings, a shilling more. So return on investment will be highest in areas with highest incidences of malaria, for the same reasons that we said, that you will save more people, and therefore you will have more benefit coming from those people, more people that you have saved. So it means that if you come from the Lake region and you are a leader there, this is where to invest. You invest there because you will get more money. Next slide. And if you do that, what I've tried to demonstrate here is that what will be the gap in terms of the funding. I've shown that if you do business as usual, that is the line down there. But if you do modest scale up, you will get the gap in between. So you can actually estimate what is the gap vis-a-vis the benefit that you get. And the same happens with the rapid scale up, because then it means you need to put in slightly more. Next slide. So what are the options we have? Domestic resource mobilization. Like I said, you can mobilize resources domestically. And domestic means from private sector and from government. From private sector, we know that we need to improve the environment for private sector to operate. Private sector do not just come to the table because you have said come to the table. You must put some incentives on the table for them to come to the table and participate in malaria prevention and control. But for government, you must be able to know how to lobby. You must be able to know how you participate in the budgeting process. Because if you are not able to present your case, like telling them that if you put money here, you will get more in a few years, then they'll only give you the bare minimum. And that becomes a problem. And that's what we continue seeing. Our red pictures do not disappear. We also need to institute mandatory prepayment schemes, and I'm happy that the government is now looking at the social health insurance and making it mandatory, because if you make it mandatory, we raise more funds for everybody to benefit, as opposed to the previous regime where it was voluntary and people used only to pay when they know they want to use it. That way you will never raise enough money to be able to fund health. But then we also have funding of procurement of some malaria commodities and supplies directly through national government, or providing conditional grants to counties. So some of the commodities that would ideally, we would benefit from economies of scale need to be bought at the central. But there are those commodities that may need to be procured from the county. We need to encourage counties also to put in money. So next, I think that's all I wanted to mention today. We have the investment case booklet out here for everybody to pick a copy. And I also have prepared a summary, because I know we may be too busy to read the full report. There is only a 2-pager. Please read it. And if you have any question, you can get my email as you go out so that we can engage more. We need to make money, and we can make money from malaria. Thank you.
I think David deserves a better round of applause than that, isn't it? When we came in, people were starting to be like, sleepy. But when David has been presenting here, I've been seeing everyone's pupils dilated. And I think I was looking at Kibor and looking at Honorable Chair, and I was seeing they are really, really following on this. This is very, very wonderful case, isn't it? David, good job. You have done a lot of great work. I think this is what we need to carry with us, a very great message on return of investment. And what I'm also taking home is my death was averted. Your death was averted, and that's why we are taxing you, and that's why you are alive, isn't it? So thank you, David, for that great presentation. I think, Honorable Chair, we need to make that case investment also to the Assembly and also to leadership, so that at least we can know that is what is remaining for us to achieve the 6% that is remaining. So allow me at this juncture really to again acknowledge the presence of our chair of the Health Committee, the National Assembly, Honorable Dr. Robert Pukose. He has been in this space for many, many, many years. He has walked the ladder of health and now in political ladder. Honorable Pukose has also been in the forefront to do what Kenya did that other countries have never done since the Alma Ata Declaration of 1978. That is putting the legal frameworks into place to actualize primary health care and universal health coverage. So last year, the chair with his committee were in the forefront to ensure that we get the 4 bills that are supposed to make us achieve universal health coverage: the Primary Health Care Act, the Digital Health Act, the Social Health Insurance Act, and also the Facility Improvement Financing Act. All that, I really, really want to say thank you, Chair. As the Director of Primary Health Care Preventive Promotive, I've been looking for you, sir, to say thank you for that great milestone that you made this country to achieve. Thank you also in the malaria space, because you do know we are funded mainly by Global Fund. The counterpart funding, actually it is the honorable members who defend it, and also the KCM proposals that we make, so that we get in the budget the monies. So thank you, Chair, for accepting our invitation to come to this media breakfast briefing. And thank you also, Honorable Aduma, for also coming, who will be our host. So because of time, Honorable Chair was supposed to have a meeting in Parliament by 9:30, but he has decided just to listen in to the investment case. So with all due respect, allow me to give Honorable Chair an opportunity to address us and also give an opportunity to the host so that we can give them time to go and serve us as they do the great job. A round of applause as the chair comes.
Thank you, Director. Good morning, everyone. I'm glad to be here. I was invited for a breakfast meeting, but I'm seeing the breakfast seems to be approaching lunch, and I have other commitments. I have a meeting to chair in Parliament on assisted reproductive health bill, which is by Honorable Milia Dhiambo, and it had gone to a 3rd reading. Then we had some amendments that were brought in. So we will have a meeting for winning, and we've invited the members who brought those amendments. Winning means agreeing on some of those amendments and seeing that we are able to bring everybody on board. And when you talk about assisted reproductive, there's some areas which are controversial, especially to some faiths, the church and other people. So we need to bring everybody on board, so you have to create time to listen to everyone. Malaria has been a big issue, especially in this part of the world. I was lucky early this year to visit Georgia, Atlanta, at the CDC headquarters. And I learned that CDC started initially because of malaria, which was found within that region. And they started it as an organization to fight malaria. And at the end of the day, they were able to finish malaria and move to other diseases, and it has grown to a very big organization. At times, when people come together because of an idea, that idea creates innovation, it creates determination by those people who are coming together, and at the end of the day, we should be able to achieve something. All of us are Kenyans. There is no Kenyan who will say, I am a Kenyan belonging to the county, or I'm a Kenyan belonging to the national government. We are all members of this country. And therefore, we need to harness our resources. And I hope that in this meeting we have those who are the implementers, especially from the counties, because those are the foot soldiers that we must be able to look at how do we work together. The Constitution, when it was done in 2010, it did not envisage a situation where we divide ourselves. It envisaged, in some of the clauses, it talks about consultation and coordination between the national government and the county government, so that we are able to bring our resources together. And I'm hoping that with the good example that has been cited about Homa Bay, bringing the incidence down to 3% from 38, I think there's something for us to learn from there. Yeah, there's something for us to learn from there. And we should be able to look at how can we be able to make all our country, areas especially where we have malaria endemic areas. And also, with the rains that are now on, we'll expect some bit of epidemics of malaria within certain areas, especially in the North Rift parts of this country where we normally have malaria surges during heavy rains. So let's put whatever we have together and harness and maximize on those resources. I was surprised to see that we spend around 13 billion every year to fight malaria. That's a huge amount of money. Yeah. Should be able to give something for that. We should be able to make a difference. So I didn't come to make a speech, but I've listened to your presentation. I've listened to Dr. Kawoya about investing in health and what we can be able to get out of it. It's a good thing. And I hope that when we move out of this room, we've learned something that we can go back and be able to do it. With those few remarks, please allow me to go back to Parliament and continue with other engagements there. But I want to wish you all the best, and this is a very fruitful discussion. Thank you, and God bless. Aduma, you know, Honorable Aduma Awor, the member for Nyakach, he also tells me he wants to be a governor for Kisumu, the big city. And you know, when you go to Kisumu nowadays, it's very clean. Yeah. So when you become a governor, you should be able to maintain the standards Professor Anyang' Nyong'o has done. But he's hosting us on Thursday, so I want to give him an opportunity to invite us to Nyakach. Please.
Thank you, Daktari. As he says, my name is Aduma Awor, the Member of Parliament for Nyakach, where we'll have the great meeting on 25th. And I want to welcome everybody. I want to tell you Nyakach is a peaceful country. We go by air to Kisumu. It will take you 45 minutes to the venue of this meeting in Lower Nyakach, Pauteng. I had somebody pronounce Pauteng as Pauteng, like somebody from the States. So I think I would want to say that it is a great privilege to be part of this team today. I'm greatly honored, and I said I would not miss this occasion. We had a very bad day because this is a Tuesday, and for him his day is worse because he's the chairman of a committee. So I want to thank you. He has said a few things. I was able to get a few things when our colleagues were talking. From the reception, the breakfast, it has been very nice. We were well received by the man who led us to the national anthem, who I saw dressed like some two big senior citizens in this country. So I want to thank everybody, Dr. Kibor, Dr. Lai. It has been nice being here. I've also gotten it well from Dr. David. And one of the issues which I heard them saying is that one of the challenges which we have in the fight against malaria is the resource. And we have the chair of the committee, who is a ranking member of the National Assembly. He's a great friend of mine. We ran in the gym together. He's in the ruling party. I'm in the party of Baba, where they outweighted us, but we work and we are very good friends. We joined at the same time, but he's more high-ranking because he's a chair of a committee, and we've served. As he rightfully says, have a dream for bigger things in Kisumu. So I'll get in touch with Dr. David. He's very good in resource mobilization, so that my dream can come true in this fight. I would have a testimony to say that malaria is a great killer. Just at the height of the campaigns in 2013, I had a son who was in Maranda, and Maranda is in Sia, where malaria is also quite prevalent. At the end of my campaign, I released my campaign team. They used to operate from Kisumu while I'm campaigning in Nyakach, which is 1 hour away. So I released my team at around 1. Then at about 1:30, after releasing my vehicles to go to Kisumu to come back for me, I got word from the head teacher that my son was very sick and they needed me there. When I called him a second time, they were not picking the calls. And I told them, can I talk to my son? And they said, no, he can't talk. So my parents, who were still alive then, those who know me well knew my parents were both murdered in the house after my election because of politics. I went and knocked at their window and said, I've gotten a call which is worrying from Maranda High School, and I think all is not well. I've been trying now to get to the teachers and nobody's picking my phone. So I think the dreaded has happened, but they don't want to tell me. I think our child could even be dead. Let me drive there. So I drove to Maranda very fast. I was able, because I had means now, we picked the kid who was unconscious, brought him to Aga Khan Hospital in Kisumu, and he stayed unconscious in the ICU for almost 3 days because of malaria. So when we say malaria is a major killer, and there are things which we need to prevent, I've had that experience and I know it is right, and you can count on our support and my friend in the National Assembly. You talked about research terms like epidemiological. I'm not a doctor. I was just looking at my friend and seeing him now this year. I'll get more consultation on what some of those terms which I did not understand meant. Thank you very much. Be blessed and know that we are together. I will join you in Nyakach on 25th. Thank you very much.
A round of applause again to our honorable members as they walk out. Thank you. Thank you so much for joining us, honorable members, Chair. Now, allow me at this juncture to invite where the rubber meets the tarmac or the road. That is where we do the implementation on issues of malaria. Allow me to invite the counties to really give us the experience and how they go about this war against this disease of public health concern. And at this juncture, I would like to invite Liliana Dayo on behalf of counties, on behalf of COG, just to give us the experience. Then we shall go to the remarks. Liliana. A round of applause to Liliana as she comes. Liliana Dayo is the CMCC, that is the County Malaria Coordinator for Kisumu City County. Kisumu City. Welcome, Liliana.
Thank you, Dr. Lenai. Ladies and gentlemen, all protocol observed, good morning.
Dr. Kibor told me to recognize also the malaria program team. Kindly be rising up. Those who are in the room, these are the achievers. These are the people behind what we have seen. MOH team, Ministry of Health. A round of applause to MOH team. Again, partners in malaria, all of us be rising. I think Dr. Kibor was supposed to give us that opportunity. But all partners in health, in malaria, let's rise. A round of applause to all the partners in the space for malaria. Thank you. Thank you. We recognize and really appreciate your great effort towards this war. To you, Liliana.
Thank you, Dr. Lenai, once again. My name is Liliana Dayo, as rightly said. I work in Kisumu County, or Kisumu City. I don't have a presentation, but I just like to demonstrate the good work that we have done through collaboration between the MOH, DNMP, and the malaria control partners on behalf of counties. Together, we've been able to do a lot. For those of us who maybe have had the opportunity to live in Kisumu, Siaya, generally the lake endemic regions, we can talk about how malaria over the years has been able to reduce. I remember in 2000, I was in high school actually, and the burden was quite high, over 50%. And every day you went to school, you'd find at least someone in your class absent because of malaria. When you'd go back home, at least someone from your neighborhood is unwell because of malaria. But over the years, because of the various interventions that have been implemented, the burden has been reducing, and this is slowly reducing. When you come to our hospitals these days, you don't find so many beds occupied by patients with severe malaria, and this is a plus and just demonstrates how impactful the various interventions have been. I'd like to take this opportunity to greatly appreciate the good collaboration we've had between counties, MOH, and the partners, including policy development. We recently participated in the development of the Kenya Malaria Policy, the Kenya Malaria Strategic Plan, including development of various guidelines and tools that are used within the country or referred to by various health workers in the country for managing and controlling malaria. So this partnership really helps us to own the process, and also makes it very easy for us to be able to implement the various strategies and activities that have been put in the policies and the strategies. I would like to appreciate the technical support we have received from both malaria partners and MOH, from the various units, including vector control. We just concluded mass net distribution in some counties. I know it's ongoing in other counties, and we have done very well. The registration was averagely above 90%, and distribution 95% in some counties. And this is because of the good technical support we got from the vector control. We also have case management, where we are now treating our patients appropriately. We are not just treating anyone who comes with fever to the hospital, but those who are actually confirmed to have malaria. We also have gotten very good technical support on SBCC, logistic management, amongst many others. I also want to appreciate the logistic support. We currently have very good and timely delivery of malaria commodities. This includes bed nets. I've had Dr. Kibori mention about Mwangi Wamaneti. Yes, he's done a very good job together with MOH, DNMP, test kits, anti-malarials, and we rarely have stockouts these days. When you walk to any of our health facilities, you will find the appropriate malaria commodities available. Data management, we have done very well here, and this is because of, once again, DNMP's good work. And I know Chisu is in the house. They've really given us technical support. And right from our community units, you find everyone appreciating the use of data for decision making. We've also done very well when it comes to innovation. And I know there are some counties where drones have been used. Like in Busia, drones were used for larvicidin, and that is very great, a great kind of innovation. And recently, we just did mass net distribution using a digital platform. So, well, just to appreciate today, I didn't have much remarks, but just to appreciate the good work that we have done together in support of MOH and Malaria Partners, and just remind you that yes, we are hosting World Malaria Day this year on Thursday. We shall be at Pauteng in Kisumu County, and I'd really wish that each and every one of us finds time to come and join us in celebrating the great gains we have made in malaria control in this country. Otherwise, thank you very much, and God bless you all.
Of our chief guest, our principal secretary for the State Department for Public Health and Professional Standards. Karibu sana, Madam PS. We had started the preliminaries. I had given you apologies to the great stakeholders and the honorable members that you'll be catching up with us as you finish a few things with the higher offices. So karibu sana. We have had an introduction by Dr. Kibor on where we are in terms of the fight against malaria and the achievements. Then we have had an investment case presented by Palladium, Dr. David, in terms of if we invest in malaria, what are we likely to get? And it was a very, very great and strategic presentation that I would like also to get hold of after this to bring to you, Madam PS, so that this should be like part of the reference manual that you will be working with, which can be used in the assembly, even at COG, the reason as to why we need to invest in malaria and the gains that we will get. So after that, we have had now an experience from Liliana Dayo on behalf of the counties on how they are going on in terms of management of malaria and the experience. And you just walked in at the right time, Madam PS, when we want now to call the partners to give us their remarks. So karibu sana, Madam PS. A round of applause to our PS as she settles. With a lot of humility, allow me, Madam PS, at this juncture to invite our stakeholders. Each of you will have only 3 minutes. Allow me to invite Zero Malaria Campaign Coalition, Liz Ntojira, to give us her 3 or less minutes remarks. A round of applause as Liz comes.
Thank you so much, Dr. Lenai. I'm true testament to David and what he was saying around a death averted. I remember my malaria story was when I was 10 years old. I had malaria, I had amoeba and chickenpox. So it was a triple threat for my parents. But yes, I'm here. Principal Secretary, Honorable Mary Muthoni Murioki, ladies and gentlemen, distinguished guests, all protocols observed. Good morning, everyone, and thank you so much to the National Malaria Control Program and the Ministry of Health for inviting us as Zero Malaria Campaign Coalition to be here and participate in this important gathering. The world has made significant steps and progress against malaria in recent decades. However, recent reports and what has been shown by Dr. Kibor earlier in the day show that this progress is slowing, with cases rising and deaths remaining above pre-pandemic levels. climate change and growing drug resistance threaten to reverse our hard-won gains. Here in Kenya, the vision is clear. We want a malaria-free nation, as Dr. Lenai mentioned, as the 3 other countries in Africa. Malaria doesn't discriminate. It claims loved ones, burdens our healthcare system, and hinders economic growth. This is why everyone has a role to play, each and every one of us in this room and those not in this room. We have a historic opportunity to be the generation that ends malaria in Kenya. Pregnant women and children under 5 are most vulnerable to malaria. We all know this. We've seen the data and the evidence that has been presented. In fact, 1 in 3 women in sub-Saharan Africa contracts malaria during pregnancy, putting both mother and baby at risk. However, women are also a crucial part of the solution that make up over 70% of the healthcare service delivery group. This year's World Malaria Day theme, Accelerating the Fight Against Malaria for a More Equitable World, highlights the importance of gender equality, health access, and human rights. Everyone deserves the right to prevent, test, and treat malaria regardless of the gender, financial situation, and or location. Investing in women's health strengthens our communities and paves the way for a more equitable world. The ZMCC, which was established in April of 2022 under the Ministry of Health's National Malaria Control Program, is a driving force for change. We bring together key partners and players across sectors to develop sustainable malaria campaigns online and offline to raise public awareness and inspire action towards achieving zero malaria. We believe in the power of collaboration, and I love saying this Swahili saying, kidole kimoja haki? Kidole kimoja? Exactly. We bring together key players, and in so doing, through our Power of Everyone campaign, launched in February 2024, we've reached 40 million Kenyans nationally and engaged over 600,000 people on digital platforms. This campaign exemplifies the power of working together. Alongside the national campaign, we are tailoring messages and calls to action for specific endemic counties. This localized approach ensures deeper impact within these communities, and our goal in these counties is to increase knowledge and positive behaviors around malaria prevention, encourage the use of malaria interventions such as treated bed nets, develop resources to support partners in promoting behavior change. The Power of Everyone campaign is a call to action for unity. By empowering individuals, communities, and sectors, we can accelerate our efforts to eliminate malaria and create a healthier, more equitable Kenya. Maintaining our focus on malaria elimination will reduce poverty and unlock economic potential in affected and impacted counties, just as the data on return on investment has shown. Just like the hummingbird, even small contributions from each of us can make a big difference. No matter your age, your location, your profession, you have a role to play. We all have the power to act, speak up, and treat malaria. Together, let's save lives and build a brighter future free from malaria. The ZMCC reaffirms its commitment to a malaria-free Kenya, and through the Power of our Everyone campaign and our collective will, we can achieve zero malaria. Thank you so much.
Thank you, Liz, for using your 3 minutes. A round of applause to Liz again. Madam PS, allow me to inform you also that the MOH team is here, the National Malaria Control Program team is here. All stakeholders in this space of malaria fight are also here, and very, very important, it's your day together with the Fourth Estate. Allow me to recognize the Fourth Estate is also here, the media houses. At this juncture, I would like to go to the next person, that is Miriam Akinyi from Malaria Youth Corps. And Dr. Tim, kindly join the table here. Dr. Tim from KHF. Miriam, come and utilize your 3 minutes. Tell us more about the Youth Corps and how you are helping us fight the war.
Good morning. Madam PS and all protocols observed, I'm honored to stand before you this morning, and I will start by acknowledging the brilliant minds that imagined, designed, and established the youth in the malaria space. Being the largest part of the current national population, it would have been unjust to, oh, I'm short. Okay. It would have been unjust to still have the youth as minorities when it comes to decision making on matters concerning them. Therefore, we as the youth, we appreciate opportunities that the government and partners have given us at the tables of decision making and involving us in various interventions for malaria prevention. We have been instrumental, especially in SBC, of course, by the guidance of National Malaria Control Program. Throughout the years that the youth have been in existence in the malaria space, we have remained vigilant, more especially on various social media platforms to create awareness about malaria and existing interventions put in place by the government. The youth have also touched the soils in various parts of this nation, reaching out to their peers, elders, and juniors with messages pertaining to malaria prevention. Being a creative generation, the youth have manifested various talents to communicate for social behavior change, and we must acknowledge the current power of everyone campaign that the youth are running with it to ensure that they end the relay race of eliminating malaria. This means that we are not ready to pass malaria to the next generation. It ends with us. However, we still look forward to being even more productive with the support in areas like research and development, case management, surveillance, monitoring, and evaluation, as we are differently and widely skilled. In these areas, we are more than ready to learn and advance as guided by those who have gone ahead of us. And today, as you can see, we are already dressed. We are heading to Kisumu right now to start the campaign ahead of the WMD. You will find us there, and we ask you to support us. We will be on social media, tweet and retweet. Thank you.
Thank you.
Very digital. You have been told tweet and? Thank you. Thank you, Miriam. Thank you. We really appreciate the good work that the youths are really doing in this space. At this juncture, allow me to invite End Malaria Council just for 3 minutes, brief.
Thank you, Dr. Lenai. Principal Secretary Mary Mudhoni Muriuki, welcome. I also want to mention that Honorable Pukose was here and Honorable Aduma, and they also gave some few remarks on today's meeting. Today, as I saw, the title was actually Media Breakfast, so I want to tell the Fourth Estate we are very, very honored to have you here. This year's World Malaria theme, Health, Equity, Gender, and Human Rights, and the attendant slogan, Accelerating the Fight Against Malaria for a More Equitable World, capture the urgency and ambition of our collective endeavor. Malaria kills approximately about 11,000 lives every year, and despite the progress being made, due largely from the governments and the NGOs and the private sectors, the End Malaria Council, which was set up to help mobilize private sector resources, both from within Kenya and outside Kenya, to help in the fight to end malaria. The National Malaria Program, which works very closely with us, and we heard from Dr. Kibo, we are here today basically to tell you that as an MOU is hopefully going to be signed between us and the Kenyan government, we will want to hit the ground running very, very shortly to then, together with our partners both locally and internationally, to help bridge this gap, which is close to about $50 million US every year. I want to say the burden of malaria in Kenya, which affects 4 million citizens, and the direct economic loss, which you have been told earlier, which is approximately $200 million, this challenge profoundly affects our children's education and future opportunities as they miss schools and fall behind in illness. With this challenge lies a significant opportunity for growth and innovation. Currently, Kenya imports over 20 million bed nets annually, in addition to other essential malaria commodities like rapid test kits, anti-malaria drugs. This reliance on external resources for life-saving tools is a clear call for action for our local industries. By producing these items locally, we can retain and circulate our financial resources within our economy, fostering growth, creating jobs, and building capacity within our manufacturing sectors. By highlighting the interconnectedness of the world and the importance of working together, the media can help galvanize support for this cause, raising awareness about the economic and health impacts of malaria and the opportunities for local production of the malaria commodities. Today, I call on the media to join us in this crucial mission. We ask you to expose these opportunities and inspire action. By leveraging your expansive reach and influence, you can help us mobilize the private sector to invest in health commodity production, turning a national challenge into an economic opportunity. And that was actually told to us by the doctor from Palladium. This will not only aid in the fight against malaria, but also strengthen our economy, creating a healthier and a more prosperous Kenya for all. Let us work together to ensure that our fight against malaria is not just effective, but fair. Let us ensure that we accelerate our efforts and no one is left behind. The End Malaria Council is committed to providing and support, together with the media, to play a crucial role in this fight. Together we can forge a path to a malaria-free and more equitable world. Thank you very much.
Thank you. Very fast, I would like to go to the next. ALMA, that is Africa Leaders Malaria Alliance, Ambassador Okwara. Our peers, Ambassador Okwara and I had a conversation. And he is in charge of a very huge region on malaria elimination. Now, I told him he needs to take us to Algeria and see what Algeria did. We go to Cape Verde, see what they did. Go to Mauritius, see what they did. But he said we start with Homa Bay. So there will be a charter diplomacy to go and see what other places did in order to end malaria. To you, Dr. Okwara.
Thank you very much. Ms. Mary Mudhoni Murioki, the Principal Secretary, State Department for Health, the officials of the Ministry of Health and the program, our various partners, members of the media and press fraternity, ladies and gentlemen. I bring you warm greetings from our chair, His Excellency President Umaru Sissoco Embalo of Guinea-Bissau, who also is the chair of the African Leaders Malaria Alliance. And we like to extend our greetings and good wishes to the ministry and all the people involved as we approach the World Malaria Day and seeking to enhance our war on malaria. We'd like to pose a question to the program as we start. Where do you see yourselves 6 years from now? National Malaria Program. Once again, as we begin our commemoration of the World Malaria Day, we're reminded that Africa is at the center of a perfect storm that threatens to disrupt essential life-saving malaria services. These critical financial shortfalls of malaria programs are linked to the ongoing global financial crisis, the impact of climate change, insecticide and drug resistance, humanitarian crisis, which need to be addressed urgently to prevent malaria upsurges. As a result, the continent is off track to meet its bold and ambitious target to end malaria. So while Kenya seems to be doing well, the rest of the continent is not quite on track. And it's something that we need to be concerned about because, as we know, all the good work can be undone if the borders are not doing exactly what you're doing. 94% of all malaria cases are in Africa. That's about 233 million cases annually. And 95% of all malaria deaths are in Africa. So we lose 580,000 people annually. aged below 5 and below. The rate of progress has stalled since 2015 in several countries. These statistics, in a more humane sense, are actually people, potential taxpayers, as we were told, that translate into lives lost, families devastated, communities burdened, particularly impacting women and children. Malaria not only jeopardizes individual health, but undermines the socio-economic development, especially in vulnerable communities. Despite these obstacles, and as we've seen, we'd like to really commend the Republic of Kenya for its relentless efforts in combating malaria through the multiple interventions. They've been very effective in indoor residual spraying, level source management, vaccines, and so on. And in our conversations earlier, we had about the other effective routes that could be considered, including introducing different types of interventions that are biological in nature that take on board the climate change issues, having trees and so on. So Kenya has done well, and it's one area that many other countries are interested in seeing how you're performing. So as we are considering taking or having trips to Cape Verde, there are those that want to come here and see what you're doing. We've talked about Central Africa. Many have made the request, and we will be approaching you to have those visits. We'd like to commit that we can actually facilitate that. And Cape Verde, I think, will be very happy to receive you. The establishment of the End Malaria Council, comprising diverse stakeholders committed to accelerating malaria elimination by 2030, is a testament to your dedication. The mobilization in Africa we have done so far, I think in the last 2 years, we've been able to mobilize $52 million across the continent. And that's just about 5 countries. We expect another 10 or so to join in having these councils in place so that we can bridge the gap. We are now heavily dependent on the Global Fund. We didn't do too well at the last attempt to replenish. We only managed slightly over half of what was desired. And even that half was only going to meet half of our needs. So we really have a challenge that we need to meet. And I'm glad that we had about opportunities for investment that can really help us to get to where we need to be. Furthermore, Kenya's utilization of data to drive action through malaria is very commendable. The World Malaria Day calls our attention to some of the bottlenecks we collectively face as a continent in our fight against malaria, key among them lack of access to essential malaria services, disproportionately affecting vulnerable groups like children under 5 and pregnant women. Climate change and humanitarian crises exacerbate these challenges, necessitating efforts to break the cycle of malaria transmission. In echoing the recent Yaoundé Declaration, let us accelerate our efforts to reduce malaria mortality and ensure no one succumbs to this preventable disease. How can we sleep at night knowing that we have the science, the technologies, the medicine to prevent deaths? We need to ensure that we have coordinated action, collaborative partnerships, research, innovation, and so on that can realize our vision of subnational malaria elimination in the 5 regions as targeted and eventually in the whole country. Homa Bay has set a good trend, but we need to get down to the bottom of all this. So the question I earlier asked the program, the goal of ALMA, which was established in 2011, was to end malaria by 2030. 6 years from now, it will be 2030. I did talk to some consultants once and asked them who is an effective consultant. And they told me one person that works so hard that they work themselves out of a job. Those are effective consultants. So NMP could be our effective consultant so that by 2030, when we meet, we shall be winding down the program because you no longer need it here. But they can become effective consultants for the rest of the continent, so they'll not be jobless, but that the function will not be required in Kenya. And that is our hope for you. So Zero Malaria starts with me and starts with all of you. Asanteni sana.
Round of applause again to Alma. We shall revisit. Yeah, thank you so much on the consultant. But good job, and we really, really want to appreciate the good work that you have been doing since 2011. Madam Pierce, allow me at this juncture to appreciate that public-private partnership is a key pillar in your State Department, And you have always encouraged us that we work closely with the private, since they have a lot also to contribute in this space. At this juncture, allow me to invite Dr. Tim Theuri, the CEO for the Kenya Health Federation, and also the president of the Kenya Dental Association, and a good friend of many of us. Welcome, Dr. Tim. A round of applause to Tim as he comes. 3 minutes, Daktari.
Katibu wetu mkuu idara ya afya ya umma na viwango vya kitaaluma, mashirika ya maendeleo, huduma inayodhibiti malaria kitaifa, afisa wakuu wa afya hapa, pamoja na sote tulio hapa, mabibi na mabwana. Good morning. We have someone from Cape Verde, so I'll stop it there and pick it up in English. My name is Dr. Tim Theuri. I come from Kenya Healthcare Federation. We are the largest organization that handles all non-state actors for the entire value chain in health in the country. And given the foregoings that have been happening, I've been telling the PS that I think we need to mirror the government governance where we equally have a CS and a PS on our side because things are getting hot. But that notwithstanding, I think what we have today is a case for a disease that can be totally eliminated. And what I see behind me, that is we innovate, we invest, and we implement. I don't think we can summarize it any better than that. From the private sector, I think one of the things that are important is investment, representing both for-profit and not-for-profit organizations. I think at the end of the day is what return on investment is there if we put money into preventing malaria. When I look at the statistics we are getting from the annual CBK survey, that is the central bank survey, the economy has been disaggregated into 3 sectors, that is finance, agriculture, and services. Agriculture because it's employing the largest cohort of our people, financial services because they're the largest contributor to our tax portfolio, and then we've all been bundled up in the services category. If we are able to have macroeconomic indicators for health, we will make a better case for malaria. And one of the things that we must bring out clearly, and it's been mentioned by speakers before me, is the impact of the loss of man hours that malaria causes, the number of school days our children are losing, and the impact and the burden on the healthcare system that malaria is causing. It takes me to my second point, and that is the need for partnerships and collaboration. We are here because of that, and for the longest time, malaria having been a programmatic disease, if I may call it that, the private sector has by and large not been involved significantly. As per the last national facility census report that was released, 54% of the bed capacity in the country lies among non-state actors. From the 2023 economic survey, that number is at about, the total bed capacity in the country is about 94,415. So you can derive what number is in the private sector. And I stand here to say that, one, we are willing to be willing partners in this, Madam PS and to all our development partners. What we need to figure out is how do we collaborate, because there's a lot of willingness in that sector, there's a lot of idle capacity when it comes to handling this, and we want to be part of this journey when it comes to ending malaria. When it comes to innovations, there are fantastic ideas I've seen around use of AI when it comes to monitoring patients who are most likely to default when it comes to malaria treatment. How do we use this, but not only use it, but scale it up at national level so that we are able to have predictors for this. Drones have been used in controlling the parasite and the vector. So what I have seen is, especially in the agricultural sector, when it comes to pesticide application in the farms and herbicide, there are much more advancements in that area. So we need to have a conversation as a health sector. How do we utilize this? And then finally, innovative financing around this is very important. The 4 landmark laws, one of them is on the Social Health Authority Fund, and I think the Primary Healthcare Fund will be primarily responsible for tackling malaria because it's generally happening in the community. So do we make this fund a tax deductible fund so that we can have the large corporates contribute to this fund before they can, before their tax obligation crystallizes? And I am sure the mobilization for money around malaria will increasingly go up. Another thing that came to my mind as I sat there was the Kenya Medical Association as a SACCO. And that SACCO has a portfolio of about 5 billion Kenya shillings. They're struggling on how to use this money when it comes to loans and financing. Can we have a conversation with them, one as a ministry and as partners, on how to incentivize uptake of this money by providers so that we are able to invest further in malaria? And one of the best cases I've seen when it comes to public-private partnerships is we run a program called the Private Sector Engagement Program under USAID, and we are focusing on local manufacturing. We have been visiting our local manufacturers, and there's a lot of capacity that I was unaware of. And one of them was a kit called Plasmocheck that is being manufactured by one of our local manufacturers in collaboration with Kemri. The brand is owned by Kemri, but we need to have a conversation on how do we bring this up to scale. It only costs, I think, 100 bob to manufacture this kit, and I think we can provide lots of this kit at various points of sale. And finally, as I wind up, my call is for us all to have collective responsibility around eliminating malaria and other neglected tropical diseases as well, because the more we put more effort into eliminating them, the better the outcomes for our country. And I remain a patriot, and the reason I say this is our countrymen must know better. They must know that malaria can be eliminated, and it's the people in this room who will make them want better, and that is a malaria-free Kenya. Thank you.
Thank you, Tim. A round of applause again to Tim. Tim from KHF, you ate into the minutes for AMREF and even Hennet. Don't know because you are KHF. But allow me at this juncture to invite Hennet for 2 minutes and AMREF for 2 minutes. Then we invite our chief guest. But before that, we'll have had WHO and USAID also on board. Madam PS, only 10 minutes. For all of you, not for Hennet. Karibu Faith.
Thank you, Dr. Lenai. Seems like I'm also short. I think that works. Good morning, everyone. To the Principal Secretary, Madam Mary, all protocol observed. I'm here on behalf of HENET, which is a network organization for NGOs working in the health space, and we are really happy to be here and to celebrate the gains that have been made in the malaria space. I know most of us have seen the strides, we've seen the successes, and we're here to celebrate together and to say we've all worked together to see the gains that we've made, and let us continue working together to see much more. And looking at the theme today around health equity, for us, we're looking at it from the point of access and also affordability of healthcare for all. And we're really looking forward to a time that we can have the PHC, as we have the act already, rolling out that everyone is going to be in a space that they can access health, but also that they can afford health. And for us, we are happy that we are in a conversation that has already set a pace. We've started with talking about what is the funding landscape, what are the gaps that we have, and what can be done. What is, how can we avert this cost, and what gains can we make out of this? And so we are really excited and hoping to call upon us for three main things. One is to congratulate us for the strides, and especially in the vaccine space, that we have a malaria vaccine. That's something that we are really happy about, that we are not only talking about prevention without looking at innovation. We are embracing everything together. But we are also excited and happy that we are here together and talking about collaboration and improved partnerships, both with non-state actors, including civil society organizations where we come from, but also looking at the communities and the critical role that the communities play. So the three calls to action from my end is, let us see how we can have increased domestic resources for health and including for immunization, and also calling upon us to empower the communities more, because we have seen that if we empower the communities, then we are going to be have a society which is strong when it comes to health prevention, and that is going to reduce the numbers which go to the hospitals for treatment. And with that, thank you so much and congratulations for us in the strides we've made, and looking forward to the end of malaria. Thank you.
Thank you, Faith. We got your 3 points, be assured. So thank you so much. AMREF, 2 minutes. Anne Kerubo, on behalf of Director Dirango. Madam PS, Director Dirango was here with us, but he got an emergency. So Anne, be as brief as Director would be. 2 minutes.
Thank you, Dr. Lenai. I think my boss, I will try to represent him as best as I can. Madam PS, Ms. Mary Muthoni Muriuki, and all distinguished guests, all protocols observed. Ladies and gentlemen, good morning. So I would want to highlight three key things on behalf of AMREF and from what Dr. Meshak was able to share with me. And I will start by commending all of us, also the National Malaria Control Program, all stakeholders, all the partners in the House, because we've seen from the presentations that we've had quite a reduction in the prevalence of malaria all the way from 2010 to 2020. We've seen a reduction from 11.4% to 5.8%. And looking at the high burden lake endemic region, we've also seen a reduction in the prevalence from 38.1% to 18.9%, which is a 50% reduction. And I think that is a very good job that has been done by all of us. The leadership of the government of Kenya through the Ministry of Health, working with the stakeholders, including the Global Fund, and also the Presidential Malaria Initiative, as well as the civil society, has been very instrumental in achieving these gains. We know there are 43 countries who have been certified malaria-free and by the WHO, including Algeria, Cabo Verde, and Mauritius, which are in Africa. And we've seen from the malaria trajectory that it's actually possible to eliminate malaria in Kenya. Now, this means that we need to reduce the incidence by at least 90% by 2030 and reduce mortality rates by 90% as well by 2030, eliminate malaria in at least 35 countries by 2030, and prevent resurgence of malaria in the countries that are already malaria-free. The other key area that we want to look at is climate and malaria intersectionality. And what we need to do is to ensure that universal access to this set of interventions that have been talked about are provided. And this may not necessarily be a technical challenge, but rather an adaptive challenge. So that means that as leaders, we need to learn and do things in a way that we've not done before. And we need to find pathways to faster eradicate malaria in a complex ecosystem. Now, the other key area that I would like to represent on behalf of AMREF is our commitment. Now, with the support of Global Fund and working with the Ministry of Health and the civil society organizations, AMREF has supported communities to fight malaria through community case management. And through this, we've been able to test about over 2 million people, and we have been able to treat over 1.7 million people with malaria since 2021, and a third of those who have been treated were actually children, and hence we've been able to save 1,000 of lives through that. And AMREF is committed to being a responsible citizen as we walk the malaria elimination and eradication journey, and we are happy to put in our capabilities and experiences into the team effort and partnerships needed to get to zero malaria. Thank you very much.
Thank you, Anne. Without much ado, I would like to invite Bart Ubamadu, the Deputy Mission Director for USAID. The 1 minute I snatched from Anne, you have 3 minutes.
Habari Asabui. Honorable CS, thank you so much for joining us today and for your leadership and partnership on this important topic. Distinguished ladies and gentlemen, all protocols observed. Good morning, and thank you for joining us here today. It's great to have a chance to speak with all of you. I will not take much time, but I do think it's important to highlight the incredible progress Kenya has made in fighting malaria, as has been shown by all the previous speakers, and thanks to the partnership, I think in many sense, between the United States and the Kenyan government. For nearly 60 years, the United States has been a steadfast partner in supporting the health of Kenyans, providing nearly $600 million annually in health funding. Through the U.S. Presidential Malaria Initiative, led by USAID and implemented with the U.S.'s Center for Disease Control, the United States has invested over $530 million to combat malaria in Kenya since 2007. Our strong partnerships have yielded impressive results. Over the past decade, we've halved the number of people infected with malaria, and we've also helped reduce the number of people in need of treatment by 10% in the last 5 years. Innovation has been at the forefront of our strategy, and we thank the ministry for this. We supported the rollout of a digital platform that has transformed the distribution of bed nets, enhanced the speed and accountability of these processes, and significantly improved coverage. This technological advancement not only streamlines operations, but also ensures that resources are utilized efficiently and transparently. Because of these programs, around 3/4 of pregnant women and children under 5 are sleeping under a bed net in lake areas with high risk for malaria. But the tools themselves are only part of the solution. To truly fight malaria, we are focused on reaching the most vulnerable. That's why, in line with this year's World Malaria Day, focus on health equity, we prioritize reaching those who may not have a voice at the table and those who are most at risk. For example, over 70% of our malaria resources go to areas where the disease burden is the highest. Together with the Kenyan government, we distribute 2 million mosquito nets across 29 counties each and every year to ensure that children, expectant mothers, and other vulnerable populations are protected. We also work with communities to teach men and women how to protect themselves from malaria. Through this kind of holistic approach and these steadfast partnerships, we believe that we could achieve our ultimate goal, a malaria-free Kenya. I am eager to share more about this exciting progress and look forward to your questions. Asante sana, and thank you so much for having us here today.
Thank you, Bart, for keeping it to the 3 minutes. Thank you for the great message. At this juncture, lastly but not least, Madam PS, I would like to invite WHO, Dr. Dan Otieno, who has worked with us in this journey of malaria space. A round of applause to Dr. Dan on behalf of the country rep.
Good afternoon, ladies and gentlemen. The guest of honor, P.S. Mary Muthoni, the deputy head of mission USAID, the county, the county colleagues who have come from far to be able to grace this occasion, all the distinguished guests, ladies and gentlemen. Good afternoon. So I stand before you. I'm Dr. James Dan Otieno, representing the WHO representative, Dr. Abdul Diallo. I will start by saying that thank you very much for convening to this meeting today, and this is to the head of the program, for us to be able to reflect on what we have achieved so far in malaria. In a few days' time, we shall be celebrating the World Malaria Day. And that day is actually meant to be able to reflect on the advances that we've had over the years. As you can see in front of you, the theme for the World Malaria Day, upcoming World Malaria Day, is advancing health equity, gender equality, and human rights. When we say gender equality, when we say equity, when we say human rights, that applies to all the community members who are affected by malaria. I believe that in this room, there is nobody, none of you at all, who has never either had malaria or had a friend, a relative, who has been affected by malaria. And therefore, these three issues are at the core of the control and prevention of malaria. Let us reflect on the statistics of it. We have yearly about 3.2 million cases of malaria, with over 11,000 deaths, as was articulated by Ambassador Okari. We know that 94% of the cases of malaria are in the African region, and 95% of the deaths occur in the African region. Kenya is not left out in terms of the advances that we have to control malaria. We do have the nets. We do have the diagnostics. We do have all the strategies that are present, that are available to us to be able to control malaria. I think we should reach at a point of reflection. What is it that we are not doing for us to be able to reach our targets? So far, every year, we talk about malaria control and prevention. Is it a challenge with our implementation? Is it a challenge with our strategies? Are we using the wrong strategies? Are we implementing these interventions in the wrong way, so that we can be able to answer the question that Okari posed, that 6 years from now, where will we be as a program, or where will we be as a country? And 6 years is very short. I would like to mention the fact that the SDG provides a framework in which we can be able to address health, equity, gender, and human rights within the health strategic goal. As Kenya, we do have the matchbox analysis. We've also gone ahead and done a baseline, a midterm assessment of our progress in terms of gender, equity, and human rights. Let us use the findings from these two assessments, as well as these two assessments, to be able to inform our priority interventions within the gender, equity, and health space. I would like to thank everyone who has contributed to the malaria control within the last few years, and hope that moving forward, we shall be able to ensure that we incorporate all this in our strategies, our upcoming policies, so that we are able to have a malaria-free Kenya by 2030. Thank you very much.
Thank you, Dr. Dan. A round of applause again to him. Thank you, WHO. Madam PS, the two honorable members who are here made their speech and remarks, but mainly they called for a lot of reassurance from the Assembly and also the committee in terms of any support that is required, both internally and even externally. And they passed their greetings to you and assured you we are together in this war for malaria. At this juncture, allow me also to pass apologies from the DG who was not able to join us. So at this juncture, on his behalf, I would like to take this opportunity to invite you, Madam PS, to come and grace this occasion as our chief guest and also give us your remarks. A round of applause as our PS humbly comes over. Thank you, PS. Karibu.
The malaria program partners, ladies and gentlemen, good morning. Oh, and the members of the Fourth Estate, good morning. Good morning once more. Why are you so sad? Why are you so sad? We have come here because we want to end this thing once and for all. And I think that is the good thing about it. And I'm sure everybody in this room is looking forward to achieving the goals that have already been set. Ladies and gentlemen, let me begin by acknowledging our partners who are present here today and who continue to provide substantial support to the Ministry of Health. And this support includes technical assistance, funding, and the implementation of a wide range of health initiatives, particularly in combating malaria and other diseases. And that includes, I've seen WHO, I've seen USAID, I've seen Global Fund, I've seen AMREF, ALMA, Propel Africa, and many other implementing partners who are in the room. And I can see the logos behind. Oh, you already switched off the logos. Let me highlight in a special way the Zero Malaria Campaign Coalition, which unites all these efforts in the Power of Everyone campaign. It has become an annual Okay. I hope you're not telling me to repeat. So the new strategy that is 2023 to 2027 is under development, and will address the emerging issues, re-emerging issues that include climate change and cross-border malaria control, leveraging on primary care networks. Remember, I keep saying, in our country, we have about 29 border entry points. And every now and then, when you look at the influx of the people coming in and out of our country again, and the change in terms of vector-borne diseases, we are prone to also have probably a bit of a change in strategy on how to deal with the issues, and especially malaria. But with partnerships through and through. And I want to encourage you, please, don't. We will not achieve if we continue working in silos. That you want to go and fundraise your small fund somewhere. Somebody else is also fundraising at the same time. The ministry is taking a lead in a big campaign, but you still want to stay in abeyance. I want to encourage all the partners, come on board, and don't come through back doors. Make sure you come through the open door, the front door, because the ministry has an open door policy. We don't close people. So please come, have a conversation with us so that we can see how we can eradicate malaria in this country. You won't do it alone. You'll keep going round in circles. And if you really want to be genuine, then come to the ministry and give a proposal of how you want us to move forward. We can't do it alone. Therefore, to all the partners, be on board in this boat if you really want us to impact and sustain. The issue here is be impactful, be sustainable in everything that you do. The ongoing cycle of net distribution, also known the Mass Net campaign, began last year, and we are aiming at completing the distribution to all the targeted communities by the end of June 2024. And we are aiming over 15 million nets to have been distributed in the campaign. You see, why I'm talking about silo operations. If you look at our mass net distribution, we surely have a gap. But somebody somewhere has money, and you have not come on board to be part of this. So if we are moving in the right direction and in the same direction with yourselves, ensure that you are at the table. This has been through the support of Global Fund and USAID, through PMI, who enabled us to raise the slightly above 15 million nets, which fell short of meeting our overall target of 18.6 million nets needed to cover all targeted population in the country. Therefore, for the other partners, come on board. We are still ongoing with this activity. It's not too late. Let's bridge that gap of about 3.6 million nets that are required. The investment may not yield the desired results of reversing malaria burden unless every member of the household in targeted regions and beyond positively change behavior and adopt the correct practice of using the mosquito nets consistently every night and in every season of the year. In view of this, we continue to work very closely with our stakeholders at any given time, who include the communities we serve, to enhance the social and behavior change communication campaigns to all the targeted communities, sensitized on correct and consistent use of these nets, among another preventive tools that are deployed to protect malaria. We are working very hard to move away from more curative to preventive and promotive. And hence, why we trained, equipped, and tooled the over 100,000 community health promoters. They have been of much help to us, and especially in the distribution of the MassNet campaign. Therefore, if all of us joined hands, then we will leave this place a better place. This is what we are terming as the true power of everyone, where everyone takes responsibility and plays their rightful role and acknowledges that zero malaria starts with every individual in the community, and cumulative efforts of all of us gives effect to malaria elimination in Kenya. This year's theme, Gender, Health Equity, and Human Rights, calls on us to prioritize better outcomes for women and girls by applying a gender lens malaria programming and ensure that this demography of our population access health services by eliminating all barriers confronting them in line with our UHC agenda. I think in the African norm, you're supposed to, in some communities, you'll find that when there's one net in the household, it is given to the man. So the man covers himself, he sleeps on the best sheets, sleeps on the, and in others it is vice versa. Because gender is not about men, it's either of them. So in others, where there's a mother and there's a child, the net is given to the mother who has the child. So sleeps on the best, under the best net. But what we are saying is whether you are a man or a woman, with or without a child, sleep under a mosquito net. We all know where we want to be to get rid of malaria once and for all. And we know what to do. Intensify our efforts. In all this, we must appreciate that to fully implement our strategy, we need to invest significantly. So it's not just about the net. What about the investment that is put in the strategy? Implementation. Where are we at? And the just ended strategic plan had or has a funding gap of about 24 billion. We acknowledge how our funding partners, including the Global Fund, USAID, and even the ad hoc support provided by the private sector through platforms such as End Malaria, have been of great value, bringing us to where we are today. Therefore, I am proud that today our partnership will, with Propel Health, through support of USAID, we have come up with an investment case for malaria control in Kenya, and this is an insightful case that demonstrates where we really want to go. The investment should focus and will provide us a path we need to take to marshal and harness the resources that we require to adequately confront malaria in Kenya. The Ministry of Health, aligning with the President government's approach to collaboration, has adopted a collaborative framework to work in synergy with all our partners to jointly support this fight, resourcing the plan to fill the funding gap and in implementing the requisite strategies. Finally, as we work on controlling and preventing malaria, we harbor the desire to fully eliminate malaria in Kenya and acknowledge that indeed malaria elimination is achievable in our country. Cape Verde, which was recently declared malaria-free by WHO, has shown us that indeed it is possible for Africa. We can do it. But just like I said, I reiterate, I can't do it alone. And you won't do it alone. We have to come together. That is why our SDG 17 talks about collaboration, partnerships. We must align with that if we really want to impact this country. I take the vow and declare and commit that malaria elimination is the destination we must arrive soon. Asanteni sana and have a great morning. My suit is ready. Or what is the dress code for Kisumu? I am waiting for the memo. Thank you.
Thank you very much, Madam Pierce, for giving us quite a powerful speech. Ladies and gentlemen, join me in appreciating her as we welcome her to unveil the new NMCP website that you're going to count with us, Madam. And the counting starts now.
How do we count?
So I'm looking at our IT. So Lecturer, you want to say?
Yeah, Madam Pierce, you'll be joined by Pat, WHO also, KHF, as we unveil the great thing that they have, the secrets that they have. That is unveiling of the revamped website for the malaria control.
Yes, you're seeing them on stage and you wonder what is it that they're unveiling and you can't see it on the stage. It's a digital age, so what we're unveiling is a very digital platform. It's a revamped website for the National Malaria Control Program, and at the count of Madam's counting, not ours, and it's right behind you there, Madam, so you can just look at the screen and you help us count. Oh yes, oh and you can see it from here.
10,
yes.
9, 8, 7, 6, 5, 4, 3, 2, and 1. Go!
Madam Pierce, may I invite from the malaria program Andrew and Mary to take us through just a bit of aspects of this new website.
Thank you very much, Madam Pierce, for raising this great occasion and indeed taking us to the 21st century. You have always told us, if you don't put your story out there, who is going to be able to speak on your behalf? Who is going to be able to celebrate you? So we thought through and felt that unveiling a new website, a revamped website, would be one of the things that we should be able to put the story out there, to put the challenge of malaria out there. And in this website, you are headlining together with one of your pet projects, which is basket distribution, and we're very happy that you are able to do that. The website has a home area where we are able to just provide context. It has an area about us, our mandate as a malaria program. It has a section of the technical areas, which cover case management, epidemic preparedness, malaria elimination, malaria in pregnancy, which is a very important core component, especially because it affects women of reproductive age, and especially those who reside in areas of malaria transmission. We have a section that also includes our resource materials, where visitors can come and download materials related to malaria, our updated treatment guidelines, some of the updated reports that we have, actually including the documents that we use as guidance documents. It also has a media center for which we'll have a gallery, which will have current news, And this event, I think, is going to be one of the first ones which we are going to be able to upload as this function comes to a close. And of course, at the end of the day, how do you get to reach the malaria program? So in this, we shall also have cross linkages with the broader ministry websites so that people can actually channel some of their interest areas and also be able to visit other sites which are important, and especially the Ministry of Health. So I'd like to encourage everyone, this is our opportunity to be able to engage, this is our opportunity to be able to look and see what is malaria control in Kenya, and also broadly, what is the Ministry of Health actually doing in matters health through the digital platform of the website. So thank you very much, Madam PS, for gracing this occasion and championing us.
Good job. Thank you.
Let's appreciate them once more as they get off the stage.
Thank you, Madam PS. A round of applause again to the PS. And a round of applause to those who created that revamped website. I think we are now digital, Madam PS. You can see we are up to the core of going digital, which is the President's directive and also your directive to us. At this juncture, we are now at the tail end, and I would request that all guests can leave at their own pleasure. Then Madam PS will be joined by the media. I think Elizabeth Ochanda, you are going to show us somewhere outside there. Then the PS will be addressing the media. Thank you so much. We all meet in Poa-Teng in Nyakach, Kisumu City County. Thank you so much, Madam PS. Thank you, everyone.
Members of the press, Madam PS will be available for the interview, and of course our partners who give their remarks here. We'll have all of them together, so none of you misses out on anything they have to share additionally for the Q&A that you have for them. Thank you.
Malaria, your days are numbered.
Malaria is very prevalent, so I've lost quite a number of family members.
Umuhimu wa kuzuia malaria ni kwa sababu tunataka kupunguza vifo vya wamama wajawazito na kupunguza vifo pia vya watoto wadogo.
Malaria is not a thing that we can joke around with. Malaria is a killer disease. It kills every day.
Malaria, you will not hold back our lives any longer.
Work is when you get your pay. So when you are sick with malaria, it means you are not going to work. So it's a disease that is very dangerous.
My younger brother fell ill this night, and I had to rush him to the nearby hospital. And when we reached there, he was diagnosed with malaria. So economically, physically, and emotionally has affected me already.
It's important for my generation to ensure we reach zero malaria because we are the vast number of people, and for us to be able to contribute maximally to the economy, to the health, and to the sustainable development, we really need to ensure that we are all healthy.
When you get the youths with the energy, with the zeal they have, they are able to influence the community in the right direction.
We are a knowledgeable generation. We do have the materials, you can access information from everywhere. So I think using that voice from a point of us being many, we can end malaria.